Hi, hello everybody. Hello everybody. I wanted to come on here and give you guys an update. So I'm just gonna give a little bit of time. Where is Subodh? Subodh is in India. He actually just left, and he just made it to India because it was a very long flight for him to get there. He's gonna be there for the next 2 weeks. He will be back March 16th. So my boo is gone, and I'm sad because I already missed him less than 24 hours after he left. So yeah, Subodh's in India, seeing his family, having a good time. I had an endoscopy today. It's a procedure where they take a camera and they go down my throat, into my esophagus, into my stomach, and all the way down into my small bowel, intestine, to check my feeding tube and everything. So yeah, I will show you my feeding tube. If you don't like to see it, my feeding tube, trigger warning. So I'm going to show my feeding tube. So this is my feeding tube. I have a GJ tube, and it's right, and you can see it's active right now. It's like making noise and stuff. Here's my fancy dancy mouse tattoo, in case you guys didn't know I had one there. Yes, and this is my tube, and it's a Mickey buttons design tube, basically meaning that it looks like a little button. A lot of people want to know how it works, but I'm gonna save that for a different video because that's not what this video is about. But anyways, my tube looks great. Everything went well with surgery. I got a clean bill of health. They actually gave me a whole thing. I actually have it right here. I'll show you. There's pictures in it of what they did when they went to do my procedure, which is kind of cool. Let's see. Here it is. Is it? It's this one. This one they gave me. I just filed all my paperwork. This is my filing thing. I literally just filed all of this right now because I had like a whole bunch of mail and stuff because, I mean, obviously I haven't been home in 21 days. Literally, I've been here for 21 days, and so I had like mail backed up for the whole month. Thankfully, my independent living worker, went and got all of it for me and brought it here. Thank God for her. I wouldn't be able to even manage my life without my independent living worker. So she comes and meets with me every single day, Monday through Friday. So this is the kind of support system that I have, because I know a lot of people are talking about Subodh and my support needs, and how our support needs may differ or be significantly different. And unfortunately, that's not exactly how it works when it comes to support needs, because one, we are our own people, we have our own support needs, and they are very similar. And we basically have this very alike in what support needs we both need. I may appear to be more like functional or like independent on my own, but really behind the scenes I'm not any more independent than he is. We are both equally independent in our own way, and together we're even more independent because we help each other, so we can support each other in ways that like can make us both together more independent, if that makes sense. So anyways, this is my final report for my GI specialty EGD procedure, and it's all in here, but basically everything was good. Like they said, they looked in there, and for the most part they actually didn't really find much, except for, you know, a few little redness spots or whatever. But anyways, these are the imaging. They gave me some cool imaging in here of what it looked like. They were looking at my my site and everything. I can see where there's some areas where they had cauterized bleeding, but other than that, really, let's see. They did some biopsies. It says impression number 1, mild gastropathy, S/P biopsies. I don't know, that's a medical term. They took some biopsies. And then 2 intact GJ tube with mild erythema underneath the balloon. But they didn't find an ulcer or prudent drainage from inside, which is good because the drainage that I've been having has been coming outside. So, and then it says otherwise normal. So, except for follow up with pathology on the biopsies. So they sent that off to pathology, and pretty much that's it. Like, I think that's all that's it. But for the most part, everything is pretty good. But still, like, my feeding tube doesn't drain properly, and that was the main thing because of the drainage and stuff. So it's a good they didn't see drainage inside because that's good. That means that I don't have crap in me. But the drainage that's coming from outside, and it's supposed to be draining through my tube rather than like out my body, right? So that was the problem with the drainage, is that the drainage is coming around my site, out my stomach, rather than coming through the tube when I connect the tube drainage to come out that way. So other than that, I can follow up my GI outpatient on that. So because that is still going on, and I have a bunch of studies coming up. I have a gastric emptying study. I have another CT scan coming up. I just had another test done or whatever, and I have a series of things coming up because I also have to get my 1-year post-op cardiac assessment, which means I have to get a heart monitor, and I have to do another echocardiogram because I just did one like not too long. I have to get echocardiogram every 3 to 6 months, something like that. So I had one and like 3 months or so ago, and because I'm having all my issues with my breathing and stuff, I have to get another one. Again, they want another one. So anyways, and then I have to get a heart monitor too. But I have to do this every year pretty much, or every 6 months because of my heart condition that I have. But I am in remission for 1 whole year now. So literally. So anyways, I'm going to scroll through some of these comments because I'm sorry, I'm not following up all these comments right now, but I'm going to scroll up and see what you guys are saying. Okay, because I know someone asked about Sabode. And Natalie wants to know, how are you? I'm doing pretty good. Eloise want to know if I was awake or asleep. I was put to sleep under anesthesia. I don't know if it was heavy sedation, possibly actual general, because of my body the way it is. I have something called dystonia, so if you don't put me fully under, my body starts convulsing, and they can't do procedure on someone whose body is shaking like that. So I'm pretty sure they put me fully out. I was not unaware of anything. So it was pretty quick. I think it was maybe 40 minutes max, maybe less than that I was in there. So what are the nose tubes for? This is an oxygen cannula. It's for giving me O2, literally just oxygen. That's all it is. It's connected to the wall back there, that green thing right there, and just giving me 2 liters of oxygen. I have an issue right now. I still have pneumonia. I'm recovering over pneumonia. I have fluid in my lungs. I'm wheezing, and I'm taking steroids and breathing treatments every 6 hours, literally around the clock. And I've been doing that for the last month, but I have pulmonary issue, and it's because of my genetic stuff. So I have thickening of my bronchial tubes, which means that the airway, the tubes that go from, the breathing tubes they're thickened and narrowed, and it's because of my connective tissue disorder, and inflammation, because I have something called mast cell activation syndrome, which is a very serious allergy condition, and it's causing the inflammation. So my oxygen saturation is okay, when I'm resting and stuff, but as soon as I start moving, anything, it's what is it called? Exercise induced, but more exertion induced. Not just exercise, but exertion. So even if I'm just sitting up and talking, or anything that gets me exerted can make my oxygen drop. So with this, I'm always at 100% sat, but without it, I go down to the 80s and the 70s, and then I feel like I'm gonna pass out. So and I get really out of breath because of this. So, and this is new. So I am gonna be going home on oxygen, actually. That's the plan. I'm probably gonna need it for a little while. And we'll see how things go. So yeah, I have to follow up with pulmonary specialist. I had my last pulmonary function test done in August. I gotta get a new one. And like I said, they're going to check my heart again and stuff, make sure it's something to do with that. But because it's the same issue I have with my heart, like congenital heart condition that I was born with, causes thickening of the wall of the aorta and the surrounding blood vessels, and it can cause calcification, or it's called atherosclerosis. And so that's the same exact thing that's going on with my bronchial tubes. So they can do surgery if it got to that point, to try to strip away some of that excess tissue, but like they did that on my heart and it gave me 4 years of remission. Then I had to get it revision, do it again, and I've been in 1 year of remission. I really don't want to go and do this on my bronchial tubes too, but right now we're not doing anything of that sort. We're just going to wait it out and monitor, continue taking meds. Oxygen is keeping me good, then no surgery, because I'll rather just wear oxygen and go under surgery again. So anyways, that's what that's for. I do still have fluid in my lungs. I have chronic bronchitis, I have asthma, and when I was initially admitted here for very severe pneumonia, and I still have recovery from that. So anyways, that's that. You are awesome. So much love from Canada. Thank you. Lebia Honest says, I just got discharged for 41 days. Hope you're not in there. Oh my gosh, 41. That's a record. This is 21 days and I'm leaving. I'm gonna be discharging Sunday, Monday. I'm hoping I can discharge Sunday so I can make my endocrinology appointment early Monday morning and my pain management appointment, because I have 2 appointments on Monday. In the morning early, 8 a.m., I have to go to endocrinology because I have a pituitary gland tumor in my brain. Yes, I do have a brain tumor. That's true. I've had it since 2018. It's called a pituitary gland tumor, and it affects my hormones. It affects my cortisol levels, which also affects my blood sugar, which is why I have hypoglycemia, and it affects my whole body, all my electrolytes, which contributes to why I'm going to be on TPN for the rest of my life. A lot of factors. Anyways, so I hope I can make that 8 a.m. appointment, and it's at 2 different facilities. So I'm trying to get discharged out of here Sunday. I gotta go to this early morning appointment, 8 a.m. Monday morning, endocrinology at one hospital. Then I gotta go to another hospital because at 2 p.m. I have my pain management follow-up appointment to schedule my next nerve block, which is another procedure that I get multiple times a year. So I do not want to miss these appointments. These are very important, especially this pain management appointment. So if I miss this appointment, I'm gonna be stuck on freaking medication that I'm trying to get off of. So, because if I don't get this, I have to stay on these strong meds to control my pain, and we all know that's not going to be good, because then I'm going to be all it's just not good. I don't want to be all loopy and stuff all the time and emotional like yesterday does. Anyway, so that's the plan. The social worker here is getting all my orders set up for home health and wound care because I have an oozing tube, so it's considered wound care. So I'm going to have 2 nurses now, unless the one nurse can do both, but typically you have to split the nurses. So I have 1 TPN nurse that comes every day, and then I have 1 wound care nurse that comes once or twice a week. So yes, and yes, my nurse comes every single day, Monday through Friday. Her time is between 9 and 9:30 a.m. every single day. She comes to set up my infusions at home. So currently, my infusions are TPN, antibiotics, and fluids. So yeah. What else? Let's see more. You and Sabota are perfect for each other. I know. He's someone asked me before, was there anything I don't like about Sabota? I guess a pet peeve or something, people in couples have things they just kind of don't really like about him or whatever. But the thing is that there's nothing that I don't like about him. And the only thing that I had to say about that is that the one thing that we don't have in common is that I'm obsessed with Harry Potter. I'm a huge Harry Potter fan, and he's not. He's not into Harry Potter. But that's literally the worst thing possible I could even think of. That's not even bad. So, yeah, there you go. That's the only thing that we don't have in common. And, but there's other stuff that, is just oddly, similar. For example, we're both gluten-free. Isn't that coincidence? neither of us like video games. That's cool, right? I guess there's a lot of things that we are like very much in common. Immediately we're in common about. We have very similar diets, like with our dietary needs, which comes in so handy for both of us when you go out to eat. We like the same foods, which is really cool. We have the same exact favorite colors, which is like a light blue and red, which is really cool. We have the same visions. Like, I'm very out of the box and so is he. So like we've talked about marriage and weddings and all that, and we're totally not traditional American style people, so like all out Indian wedding, all out for me. So yeah, anyways, spoiler alert, he's in India right now. I hope he gets some really good ideas in his head. I hope you're doing well. I'm glad your surgery went well. Yes, baby girl, I miss you, sis. I love you. Everybody go follow Carla LBCC. She's my foster sister. We both grew up having issues with our birth mother drinking alcohol and stuff. So we have fetal alcohol syndrome, me and her. And yes, I am diagnosed with fetal alcohol syndrome, but she's my sissy. And we went through very similar situations and ended up like becoming foster sisters and going to school together and living together, and go follow her. Okay, it's nice to have someone in your life that you literally go through the exact same thing as. We've had some deep conversations about this, and it's so nice to have someone who's been through it with me at the same time, pretty much. Well, I mean, I have my other siblings, my biological siblings, because we all went through this. I'm one of 5 kids. We all went through this, the foster system. But, you know, being a foster kid's not easy, you guys. It's really not. That contributes to why I didn't know about my autism, because I was in foster care. And you can imagine that I never saw us, like, following care, continuity of care. Is that how you say it? You get what I'm saying. I never had like a followed care where I'm like seeing. So it was every time I went to a different doctor and a different diagnosis and a different assessment and a different opinion and a different disorder. None lined up. None of it ever did, because it was all different. And then you look at all my evaluations side by side. The only thing that's consistent is I had a significant developmental delay and failure to thrive, like in every single one. And then everything else is different. Like, you know, oh, she's this, oh, she's that, she's this, she's that, she's this, she's that. And none of it's the same. None of it continues. It's all different. I'm like, this can't be. I can't possibly have all of this. Like, and yeah, the whole like misdiagnosis with bipolar as a child is true. It happened to me, and it's pretty ridiculous because yeah, you can't diagnose a child with bipolar. So how is that possible, right? I saw in my paperwork from foster care that they tried to diagnose me with bipolar at 7 years old. No, you don't. I was a child with trauma. I was abused, neglected, like in so many different ways. I was acting out. Unknown autism, that can appear like. I had outbursts, like any other autistic kid. I had outbursts. I couldn't communicate. I couldn't tell what I was feeling. And I got more frustrated because they were drugging me with things for the wrong condition and saying I have the wrong thing. And I knew my whole life that I didn't have that. Even as a young child, I knew I didn't have what they said I had. I knew I didn't need medication, psych meds. I knew I didn't have what they said I had. Even as a young child with my own, like, disability, like having, you know, developmental delay, failure to thrive, all that, I still knew what my body needed. I still knew I didn't need those medications to be put in my body because it wasn't helping. It was harming, and I still knew that I was getting the wrong treatments. I wasn't getting the help that I needed. So I acted out. Of course, I have all these huge tantrums. I go into I'm put into a mental hospital, you know, one of those situations because I'm out of control. Like, I mean, I'm in control now. I was a kid, but, like, just can imagine how scary that was for me, because I still to this day am traumatized, and I remember these things very vividly. So that's the problem. Anyways, yeah. You are awesome. So prayers lift for your healing. I already feel so lifted already. All your prayers are